My light bulb moment came when through my Facebook feed, this photo came up. And I'm thinking, what are my legs doing on Facebook? And I showed my husband and I said, who do these legs look like to you? And he said, they're yours, but what are they doing on Facebook? And that's when I realized, you know, I've got something wrong with my legs. It's not normal and I need to look into it. And that's when I started this journey of finding out what I had wrong with my legs. Lipoedema Australia has 6,500 members, and we're constantly hearing from these women that they go to their GPs who claim that they've only got to lose weight and their problems will be solved. And they know nothing about lipoedema. In fact, sometimes they even think that we've got lymphedema. It is us educating them.
I've been told by doctors I'm obese and I need to exercise and I need to diet. But lipoedema is a connective tissue disorder. It is not obesity. Cellulite and fat is not lipoedema. So educating doctors, each time I go in, it becomes frustrating because it's a disease that people are not aware of and we need to spread the awareness. I was never overweight as a child. It was through the hormonal changes that I had through childbearing and now through menopause that I developed large pockets of fat, which was not typical fat that you can lose through diet and exercise.
Lipoedema is a hereditary condition, so it tends to run in families. And some of the symptoms include a smaller waist, but a bigger bottom or legs. Legs bruise easily, or they can feel tired and heavy and cause quite a lot of pain.
Now there is a recognition that the condition can be a triumvirate of venous disease, lymphatic disease and fat disease, i.e. lipoedema. And these three can coexist and all need to be treated and recognised at the time of treatment. So not everyone who has lipoedema also has significant venous disease, but nonetheless it has to be assessed to ensure that if the decision is to go ahead with liposuction, that they're not doing it in the face of significant large veins or even varicose veins.
For me, veins were an issue and I needed to get them treated. And I recently did do that and it's been a godsend. It has reduced the pain that I experienced and it has allowed me to be a lot more mobile. Lipoedema is a connective tissue disorder. So a lot of women with lipoedema are either hypermobile or super flexible, double jointed even, and that causes a lot of pain and stress on their joints.
We're here to petition the Federal Health Minister. This disease is not something we can lose weight with. We need an item number for Medicare so that we can get funded for the interventions that are required to help us with this disease. This creates a lot of disability in people, and they end up in wheelchairs and some end up bedbound. The mobility issues this disorder creates is unbearable for some women.
Clinical studies show that 85% of women with lipoedema suffer some form of mental health issues, be it depression, anxiety, or even self-harm. For decades, lipoedema has been swept under the carpet. There are many women who suffer this condition. Often it affects their relationships, their friendships, and their whole persona and how they feel about themselves.
While there's no cure for lipoedema, there's lots that we could do to manage it. We can do manual lymphatic drainage either through a therapist or through having your own pump at home. Walking in water, this is simple compression just from the water. We've also got compression garments that we can wear on a daily basis.
Manual lymphatic drainage and compression garments are the key elements of the management of lipedema. An early diagnosis is important too. The earlier we start with the therapies, the better the results. I see patients in my practice turning back time, avoiding surgery, or stopping or progressing or slowing down the progress of lipedema by complying to these therapies. Compression garments come in a wide range of qualities. We have the round knit material and we have the flat knit material. We have day garments and we have night garments. I usually start with a lighter material to get the patient used to the compression, and we move on to flat knit, often custom-made garments, which are needed pre and post surgery and when we treat heavy tissue.
Anti-inflammatory diet really worked for me. So it was low carb, no sugar, no alcohol, which was a doozy, and obviously not smoking. Basically just not eating those processed foods.
Recently, scientists have identified a gene for lipedema, and within the next 5 years, once we get a formal blood test, we'll have the evidence we need to get this item recognised under Medicare. In years gone by, I hid myself away, I covered up. But today, you look around the community and these young women who are inevitably flawed, happy to have everything out, these people are the true lipedema warriors of the future.